This podcast is for educational purposes only and does not provide medical advice or create a doctor-patient relationship. Please do not rely solely on this discussion. Always consult your own healthcare provider and verify information independently. If you're in crisis or experiencing a mental health emergency, call 911 or go to your nearest emergency department.
First of all, thank you very much, Zermaan Khan, President of the Islamic Society of Kingston, for joining us on today's session. So today we were hoping to talk a little bit about stigma in our community. You are the President of the Islamic Society of Kingston. First, tell us a little bit about the Islamic Society of Kingston and how you chose, to take on this important leadership role.
It definitely came upon me very quickly. But the Islamic Society of Kingston alumni has been around for quite a while. I think more officially since the early '80s.
Mm-hmm.
So a little over 40 years at this point. Actually rounding itself to almost 50.
Wow.
I'm dating myself now at the same time. So the community, very small at that time, just a handful of families. We had individuals through Queen's University at the time, one as a professor, a few as students that were like, we should have an organization. So they started originally back in the 60s. So
right.
Anyway, it progressed, and then through the 80s and 90s, as a lot more influx of Muslim families started to come into Kingston. As that happens, your needs, the demands, so on and so forth, start to expand. So we got into a position where we definitely needed a mosque to have a place for everyone to congregate, and the mosque was finally built back in 95, 96. So, we've been fortunate to have a place for the last 30 years. As the community has experienced exponential growth in the last 20 years, I would say, we're now in the position of expanding it. So we're working through an extension right now, and hopefully that'll be done next year. So, and the community is, it's a diverse community. Again, you have Muslims from every part of the world that are here for a myriad of reasons. Education, obviously, is a big piece here in Kingston, but we have a lot of professionals here in Kingston. You have a lot of entrepreneurs, business owners, and those that are working, corporate or public service, private sector jobs. So you have a wide mix of individuals that are here in Kingston. So it's a vibrant community, and it'll only continue to grow. But it's important to have an opportunity like this to sit with you to talk through some of the other areas that don't often get talked about all that much. So looking forward to the conversation today.
No, thank you very much for that introduction. In Islam, in your understanding, how does Islam view mental illness, mental health, well-being?
So, when you go through the religious tenets on overall health of an individual, it's very intertwined with the faith itself, right? The Islamic tenets that are there as to how to go about living your day, how to prepare yourself before you go to sleep, and then again from when you wake up in the morning. So if we focus well on staying in line on just the general parameters that are there, you're usually moving in a fairly healthy manner, but also now supported and backed up by a lot of science.
Right.
There's a lot of things 1,400 years ago that were prescribed, which now science is able to support. Even praying 5 times a day, it's good to be physically active.
Right.
These are simple things to understand. Fasting during the month of Ramadan, it's great to fast and cleanse your body of toxins. There's so many different things. So,
and it also has a positive mental health effect on it as well.
Absolutely, because if you're living well, feeling well, you're well all around. Your mental health is in a much stronger place, right?
Exactly.
So, and you'll hear that through so many different faiths as well, and different general practices on meditation and contemplation, and so these things are critical and important. But then there's so many other factors outside of that that impact an individual that might detract. So you may be doing all of these things, but let's say you're struggling financially, right? That's a little bit of a problem. You're having issues in the home or from familial issues or what have you, right? So you're working on all of these things, but then you got these other pressures starting to come in. So thankfully it's often described as the most complete religion, because the prescription, as I explained to you how to live your day, what you're eating, what you're not eating, the whole methodology behind it, really puts you in the best possible position to live a pretty good standard of life. But, no matter how well you do, you still get hurt, right? You can break an ankle, you can get hurt, anything can happen. So then you need to seek out the right level of assistance, support, and help to be able to deal with those things.
Exactly.
Which, for us in our belief system is all from Allah subhanahu wa ta'ala, it's all from God. right? So he provides the intelligence within the individuals to be able to share that in whatever capacity it may be. So along with our faith, we understand that it's good for us to seek out the help and support when we need it. But we still have a long ways to go in seeking out the
Do you
help and
think
support.
religious leaders are more aware of mental health? You see, I feel that a lot of people in the Muslim community is that if they feel that they have some stress, some anxiety, some concern in terms of their mental health, perhaps would seek help first from the local religious scholar, local imam, and just to help some guidance. And because there are some religious teachings to help with mental health as well. Do you feel that local imams are more aware of mental health at this time?
I think a lot more work is required there. I don't know definitively or collectively as to, I'm sure some imams would be better in that or level of awareness. Others maybe less so. I think it depends on the level of engagement that imam has more broadly within the community.
Right.
And then again, leveraging the professional supports that you have around you.
Yeah.
But again, if you really think about it, in any religious institution, but obviously for us as Muslims in our community, imams go through level of training and education to become religious leaders, scholars
exactly.
for you. But they're not trained as professionals in mental health or social services, for example, right? So there's a lot of areas there where they can, from a religious standpoint, of course, as you mentioned, there's a lot of things that you can employ within your life to kind of help things along and focus on things and deal with things in a better way. But they need to be more in line with understanding we're not the professionals here. We need to get the help. So I feel, and generally speaking, in my own experience through life and growing up here in Canada, that there's a lot more work to do there. So I think there's a lot more that we can do to help the imams become better equipped to know how to direct the individuals and how to identify. Right, that's the other thing. So how do I truly identify what issue is an issue? And oftentimes you wouldn't be able to if you're not professional in a particular discipline. You won't be able to diagnose.
And understandably, because you see, the thing is, a lot of people, they may not have a family physician or may not be inclined to go to their family doc for that initial consultation, for that initial support. So I think it's a responsibility on all of us to get around the table, because I mean, our local imam here in Kingston, I know we've spoken on many occasions that he has a fairly good understanding of mental health. But as you said, there's always room for improvement. In our community, in terms of stigma and mental health, as president of the Islamic Society of Kingston, you took this role on
April of this year.
April of this year for 2 years.
It's a 1-year term.
A 1-year term. Okay.
And then it's supposed to renew for another 2 years come next AGM, but I think there's many more qualified individuals to take over there. Well, we'll see.
You're doing a tremendous job, and I'm sure you've been speaking to a lot of people, over the months in terms of different challenges and different difficulties they may be facing. From your standpoint, if I was to ask you about stigma in our community in relation to the Muslim community, what are your thoughts on that?
There's still quite a bit of stigma there. Still quite a bit of stigma. People still don't want to discuss these issues openly. They'd almost rather, pray it away, for lack of a better phrase, meaning let's deal with it at home. We can figure this out. No, it's not that. Because of course you don't want anything to be identified as a problem, right? And you're like, no. It's just this and that and whatever, right? Trying to attribute it to anything else. And again, these are general statements I'm making here, and I'm sure you may have heard this as well, even culturally, right? Like, oh, okay, he's not married yet. He needs to get married. Once he's married, things like, oh, she's not married yet. When she's married, this will be fine. Oh, it's only because they're, this old, or maybe they're a little bit older, they'll be fine. Or, okay, once they get a better job and things change for them, they'll be fine. Oh, maybe they just need a different scenery. Maybe they need to move from this town to that. Maybe they need to go stay with relatives over here for a little while, and so on and so forth. So there's still, I think a lot of that. The good thing for us that are in North America, Canada, USA, Europe, and other areas where these topics of discussion are on the rise, and healthily so, as they need to be. It's forced, I think, a lot of that understanding to start coming forward. So I would say that there's probably more of an opportunity today where individuals might still seek out layers of support and assistance to offset that stigma and not be concerned about it than ever before. And I mean, of course, generationally things change, but still vast majority of individuals are not looking to seek out help to review mental health issues that might be there or might not be there in their family. But we need to do a lot of work to continue to dispel the stigma. for sure.
But what role do you think mosques and religious institutions can play in trying to address this?
Right. Well, a huge role, because they're looked at as the trusting center for them. It's where they oftentimes are going to ground themselves, center themselves, and seek out opportunity to, one, be done with the troubles of the world, go in and elevate yourself as best as you possibly can. And because there's that intrinsic level of trust that's there, right? And you're like, okay, well, this is safe space. This is a mosque. I'm a Muslim. I feel comfortable here. There's other Muslims here. Maybe I can, chat with them a little bit. And you see it already with so many other things. Newcomer comes into a city, let's say they come into Kingston, oftentimes they'll seek out connecting with the mosque first, right? So the Muslim come into the city, let's connect. If there's a mosque available, alhamdulillah, we have one, connect with the mosque. Through the mosque, now let's understand what other services are available.
Students as well,
in large numbers. They'll come in, they're alone, coming from any part of the world.
Right.
Like, okay, well, I should be able to find some help and support here. So it's already positioned to be in a good spot to have people coming there naturally and organically. So you have that opportunity, you have the platform to say, okay, well, people are already coming here. We're a trusted entity for them. It's a safe space for them. Let's now continue to bring layers of education and information in all areas.
Right.
But especially when it comes to mental health. So I think it's probably one of the best ways to be able to impact the community, for sure.
Any initiatives on your mind in terms of the Islamic Society of Kingston?
Yeah, we're fortunate. I mean, we have you here. We have Dr. Kulsum here. We have other professionals.
Dr. Kulsum is a psychologist.
Absolutely.
With JK Mental Health.
Right.
Yeah.
So she owns J&K Mental Health. And again, she's got a footprint around the globe, really, right? So from the UK and the business has expanded so well because the demand is so high.
Exactly.
The demand is so high. So we're fortunate. So if we go back, 40 years ago, we didn't have any psychologists, psychiatrists, psychotherapists directly from our community. None at all. So it's a huge benefit now that we have individuals from within the community, one, that are visible, they're seen, people, they're like, oh, okay. So I'm sure you might get sidebar phone calls oftentimes because of the stigma where they don't want to come in an official setting. So like, maybe let me talk to Dr. Tariq on the side, or maybe talk to Dr. Kulsum on the
corridor consults.
Exactly. Yeah. But thankfully, in conversations both with yourself and with Dr. Kulsum, we're looking at trying to bring in opportunities to inform and educate the community in all areas of mental health and familial health and marital health and support. And we're looking at couples therapy with Dr. Kulsum, looking at potentially a panel discussion coming in the new year, more focused on mental health, right? So we'll be looking to you for support on that, to again, just help the community understand that these are okay conversations to have. You have resources available to you. Seek them out and try to, get the type of help that you're not even knowing is out there and available for you, right? You don't even know that. So we have a responsibility to bring that knowledge forward.
Because a lot of the time, the delay in seeking help can affect the mental illness as well. So the more time that elapses for certain mental disorders, especially, the more time that elapses, the more resistant almost it becomes to treatment.
Wow.
So the sooner, because what happens, whether it's a psychosis, a bipolar disorder that might be just slowly evolving and developing, it's easier to treat at that point in time, whether it's with medicines or psychotherapy. But the more time that elapses, it becomes more and more resistant. And then, unfortunately, what I've seen in not just the Muslim community, in other parts of the community as well, is that then it reaches a point where the police get involved. I mean, assaults, things get quite serious. And then having to funnel, because I've worked as a general psychiatrist and as a forensic psychiatrist as well. So then those cases then get funneled through the criminal justice system.
Right.
So things can be prevented from reaching that point if help is sought sooner rather than later.
See, that's so critical in just knowledge and understanding. Because I wouldn't have thought that. Right? I would have thought, okay, well, anybody can be helped at any time. So see, this is critical for the community at large to understand. Hey, listen, delaying seeking out the assistance can allow the problem to go to a point where it's so much more difficult now to reverse it back, right? So when you mentioned the criminal justice system, I would imagine there's probably a lot of layers of improvement still required there, because once you're in through that criminal system, you're still, I guess, looked at as a criminal, but also getting mental health?
Because then there's a double stigma
Right.
attached to that as well. You have a
Right.
mental health issue, you've been through the criminal justice system as
Right.
well. But it's a fairly strong process. No doubt there's other areas, significant areas of improvement needed. But within the criminal justice system, if you are charged with a criminal offense,
Right.
then there are different points within that journey that a mental health assessment is required
Right.
and
Wow.
is requested. So that could be an inpatient assessment, that could be out of custody assessments, but then it's a path that could potentially be avoided if, help is sought out
Earlier.
Right.
Yeah. Right.
Yeah.
Okay. Wow.
Mm-hmm.
See, so critical to have this front and center with our community. And we look forward to doing it.
Mm-hmm.
Yeah.
Do you feel that there are any misconceptions about psychiatry or therapy that you often hear in the community?
Yeah, I think, again, just a general stigma, right?
Mhm.
Like, you have to be crazy to go and get the help, right?
Mm.
In our language, Urdu, "Pagal banda isliye ja raha hai."
Mm.
Person's crazy, that's why we're sending him over.
Mhm.
So I think there's still a lot of that. There's also a lack of understanding and knowledge on the differences, right?
Mhm.
So psychiatry, psychology, psychotherapy, right? So
Right.
often people are like, yeah, it's the same thing, right?
Right.
Psychiatry, psychology, same thing, right? Which you can inform us better that it's not necessarily the same. There are differences within there and
Mhm.
different areas and streams of support to be
Right.
achieved through that. So yeah, I think, people still have misconceptions, dated misconceptions about what treatment even looks like
Mhm.
today, right? And what kind of support and help can be achieved,
I think with other areas of illness, we don't attribute it to our identity. And I think with mental health, it's attributed to an identity part. And I think that's where people, the more it becomes mainstream in terms of the discussion, the
Right.
conversations, the less it is seen as part of their identity. Because when they see a mental health issue, the concern is that if it's a person with schizophrenia, for example, hearing voices, having delusions of persecution,
Right.
people believe that this is that part of their personality structure. This is just
It's who
part
they
of
are.
who they are. Exactly. So, and that's where we need to be doing a better job in terms of mental health professionals as well, in terms of getting the word out there,
Right.
which is why I'm super thankful for you coming today.
No, happy to be here.
talking about
Because
this.
you're absolutely right. Because once that title gets attached to someone, and that's the fear. That's where the fear comes from. I
Right.
don't want my son or daughter or husband or wife or brother or sister to get this title attached to them now, or that identity now,
Mhm.
because they'll only be seen that way going
Right.
forward, meaning you can never be healed, you can never be better, you can't get to a better place. So
Mhm.
that's a critical piece, I think, in all of it. So helping people understand that, listen, people can get better,
Mhm.
and it's not how they need to be identified.
Exactly.
Yeah, that's huge.
Any closing remarks?
Well, thank you, one, for being in Kingston, staying in Kingston. You're not allowed to leave. Others may have already told you that. But thank you for making this space available online and sharing these types of discussions, because it's important and transcends not just our community, right? People, I'm sure, are tuning in from every walk of life. But again, it just goes back to that same notion of trying to inform, educate, raise a level of awareness so we can, as a society, move forward together in the best way possible. Help people on a daily basis is what you do all day long, every day, right? So it's gratifying work that you're doing. We appreciate that you're, bringing us into your space to be able to have these discussions. And we look forward to having you join us to do a lot more work with the community as
I'll be
well.
more than happy to do so. Thanks again for your time. Really appreciate it, Zermaan.
Thank you.
Appreciate it.
Thank you, Dr. Thark.
Take
Appreciate
care.
it.